Hello there, just doing a bit of a in-between vlog thing. Wasn't really planned, but after, early this week, as people who have read my blog may have read, is that I went to nearby hospital. Was for getting some plain, regular, normal medical symptoms examined and just some abdominal issues which anyone could have, and you would think that, okay, well, your abdomen is all the standard and you have weight gain and simple symptoms like that. Let's just do an ultrasound or a scan of the abdomen and some other tests. And while I was at the hospital, I just got told by the doctor that, sorry, we cannot help you because you have this really rare disease called intersex and we don't treat that here. We cannot help you, sorry. That was the gist of it. They do not want to touch your abdomen. They do not want to do anything with that. There are no scans. There is nothing. I could try my luck at the gynecologist department and maybe I would have more luck there. But they would probably not have any idea what to do with me either, because they just treat a regular woman there. And when you're there for something like endometriosis, well, guess what? How many other hermaphrodites would you actually see there? So, I guess that's really what I already wrote one blog post about that. Just this... the fact that, at least here in Germany, they refer to intersex in medical circles as a rare disease. For those cases when they do not outright refer to it as a disorder, with this whole fun DSD term, this disorder of sex development, which should pertain to anyone who is actually infertile in some sense, I guess. But hey, let's not do that. It's just a way. As I wrote before, this whole thing with the DSD and also this rare disease thing, it really goes back to at least the 1920s, 1930s, with the whole thing about racial purity and the way they looked at hermaphrodites, as they were called, just, and all intersex people called hermaphrodites because of the whole Greek mythology thing with hermaphrodites, the offspring of Hermes and Aphrodite, who turned out to be both male and female at the same time. And so, that aside, back then, 1920s, 1930s, in Germany, they considered intersex people to be a symptom of racial impurity and basically symptoms of degeneracy, of faulty genes, and they should not be allowed to procreate and all that kind of stuff. And in light of that, noticing that people in 2020 in Germany are in the medical profession are still referring to intersex as a rare disease, and they have widely adopted this whole disorder designation, and the medical disorder isn't just something you just slap onto something which you think is kind of funny. A medical disorder is something that is debilitating, is not compatible with a normal, healthy life and existence. In that light, I look at myself, my own body, as a true hermaphrodite. And, well, as a true hermaphrodite, I'm also a chimera, because my body should have been two individuals, because they're, like most chimeras, they are formed, chimeras are formed when you have two stem cell lines which merge, usually in the uterus at the early states. And that's how you end up with people who have different DNA, for example, for their blood and their skin tissues. So, yeah, you may have heard of cases, happens. this one woman where they thought, well, she was actually not the mother of this one child because the DNA differed, but it was just because she was a chimera, and that's why she had some different DNA in the cells which examined from her, but actually a uterus was the right DNA, so stuff like that. Chimeras are totally cool, there are plenty of them, and it's never an issue. Then why me as a chimera, which just happened to be formed from a potential twin, which just happened to be a male and female zygote? Why is that suddenly problematic? Okay, I mean, my genitals formed a little bit funny, and I very likely was never fertile in any real sense. But does that make me unhealthy? I mean, do I have a disease? Do you call it a disease? I mean, I've got funny DNA, probably, if you were to really examine all tissues in my body. Got like 2 stem cell lines, and okay, my genitals are a bit weird, but I mean, like, who cares? I mean, there are so many people who are considered, who are not intersex, who are considered to be completely normal and healthy. They just have some fertility issues, as it's being called. And some people think that's a problem, others think that it's not a problem, and you can be perfectly happy even if you do not have any reproductive organs at all. I mean, they are not essential for normal life. You will not die if you do not have reproductive organs. I mean, at worst, you will have to adopt a child instead of just do something with your own DNA, insofar as that makes any real difference, which is, of course, controversial, but let's not get in there. So me, I guess this really means that the possibility of me as a true hermaphrodite, as an intersex person, in the West at least, getting any kind of real medical help, even if it's for normal issues, you know, just if it's something for your abdomen, something there, something little thing, and it gets immediately connected there with this disease that you have, this intersex thing, and it's hands off, and just get that fixed first, like that's normalization surgery, let's get those genitals of you chopped up. I mean, until your genitals are conformant to this binary standard, we shall not treat you, or something like that. I mean, I've been stuck in that system, that's kind of medical system back in the Netherlands and in Germany and UK and other medical systems of other countries and the US. I still don't get any of that. Like, the reasoning behind it, do they even really consciously think about what they are thinking and saying? My guess would be like, no, they do not, because even as a medical professional, you cannot call, I mean, disorder, medical disorder. Where's the medical disorder for something like me, for someone who has complete AAS? I mean, perfectly normal, healthy, they just, during development, their body just were like, well, we just ignore this one thing and we do the other thing. But they're still perfectly healthy and normal, and they still develop normal genitals, pretty much. I mean, like, just because you have XY chromosomes doesn't mean you have to be a guy. I mean, that's ridiculous, because it's not just chromosomes. I mean, I've got XY and XX, one body, and that happens. Does it make me diseased? I mean, if you have different DNA in your body, I mean, because sex chromosomes really don't play a really major role in the entirety of your whole body, because you've got, I mean, you've got so many more chromosomes with so many genes on it, which are way more important for basic proteins, which you need to actually, like, not fall apart, you know, like actually having proper skin and to not go blind, and if your cells keep functioning, stuff like that. And if you have an issue in that, okay, that is a problem, that is a real disease, and then you've got a real problem. But this is really frustrating. It's really frustrating because you know it to be a lie when they, on the page of the hospital, the clinics, website, they stated on there, oh, it's DSD, it's a rare disease, and you know it's be a complete and utter lie and medically incorrect. And it's still, I mean, you're not going to do anything against that because you're just a patient. I mean, what the hell do you know? I mean, you've just been reading up on the intersex stuff and everything related to it for like 15 years. What the hell would you know about any of that? I mean, okay, I've been studying it for longer than they have had. I've done their medical study, but aside from that, sure. I mean, okay, then I guess we have to accept that I've got the disease. And yeah, this whole DSD thing, yeah, totally. I've got a disorder, medical disorder. I'm not sure what exactly would be dysfunctional, but sure, just accept it and the disease. I mean, obviously something must be wrong because, I mean, they're medical experts. What would I know? I mean, you get kind of fatalistic after 15 years of this, I guess. It was being there at the hospital and just having to deal with that nonsense again. It's frustrating because you know that you can't do anything about it. There is no recourse. You are not going to wreck them. You are not going to change their mind because, I mean, you're a patient, they're the doctor, they have learned for it. Your 15 years of being deeply involved in this topic are completely irrelevant. You having this particular body and intimate knowledge of it, completely irrelevant. Like, so that's basically where I am right now, and I imagine that many other intersex people like myself are also finding them pretty much. Basically, accept you have well, don't get treatment, or just accept that you have this disease, that you have this disorder. And as they tried to do for me for 15 years, basically try to convince me that normalization surgery is the way out. So pretend to be a transsexual, you know, just say like, okay, well, I'm going to pick a side now. Like, I was born like this, and well, I guess I would feel least unhappy with this binary side. So let me just pick, do I want to pretend to be male to female or female to male transsexual, and do that thing, get it over with. And you know, when they take, just fix the issues, then you will be happier. But you cannot accept that you're intersex because that is a disease, and nobody accepts a disease or a disorder as part of their personality or this who they are. I mean, that would be wrong. That would be like accepting that you're homosexual. I mean, everybody knows it's a disorder, you know? Disease. Totally. Fix that. Get it fixed. So maybe at some point in the future that you're actually allowed to be intersex and they will not call it a disease anymore and they will not call it a disorder, and you can just be, I don't know, intersex, just yourself, like nobody cares. I mean, why would anyone care about me? I mean, I'm healthy, and who cares about my genitals? I mean, are you dating me? Are you dating me? You're not dating me. Why would you care? You know, you're not my doctor. Why would you care? So, until I'm talking with my GP or with someone who is actually dating me, then I don't think that the topic of which genitals I do or do not have, or how well they function, or how fertile I am, is really anyone's concern. But somehow, over the years, I've had to talk about it so often and in so much detail. I mean, on freaking talk shows in Netherlands and in magazines and all of those details, and it get all those questions, and none of that would have happened if I would have just been treated like a human being. I guess the answer. Because I mean, if you're born like a regular male, female, and you have some fertility issues, then you go to fertility clinic and they just examine you and you're like, okay, well, it doesn't work because that or that is broken. And if you have some weird abdominal troubles and pain, then you just get a scan and you get it diagnosed, and yeah. But if you are intersex, then, well, obviously that is the problem. So, I don't know. all I can do at this point is rant about it, and it's little further recourse. And we'll just have to see how this all continues the coming weeks, months, years. Whether anything will change in the next 15 years. Some I doubt it, but I never know. I mean, maybe me actually finishing my autobiography this year might change something, getting it published. Or if it'll just sell 25 copies and that's the end of it. But you never know. I mean, I kept trying to find help for 15 years. I'm still trying to find help. You just have to get ever more creative and just keep taking the hits and hope at some point that things will just get better. And it might. I mean, the moment you give up hope, I guess, is the moment when you may just well lie down in your coffin and that's it. So, I don't know. It's... I guess that's all I can say about it at this point. I hope that at least someone is still listening at this point. Thank you for listening, if you're still listening, and thank you for caring. And until the next video, I guess. Take care.